Hi everyone, welcome to another video of Picment Show. Today we have Shizisa on the show. I welcome Shizisa on the show. Hi
Thank you,
Shizisa,
sir.
welcome to the show.
Thank you, sir.
Here I am giving opportunity to the guest to introduce yourself.
So, first of all, thank you, sir, for having me here, and I'm honored enough to share the screen with you.
Okay.
Myself, Kshitija Sharma. I'm basically from Himachal Pradesh,
Okay.
and I did my bachelor's of nursing from the very renowned institute that is AIIMS Rishikesh, and I completed it in the year 2019. In the same year, I started working there as a nursing officer for the time period of 1 year.
Okay.
And then I am fortunate enough to qualify the MSc Nursing Entrance Exam, which is conducted by AIIMS Delhi.
Okay.
And from the same institute, that is AIIMS Rishikesh, I completed my post-graduation in the subject Psychiatric Nursing or Mental Health Nursing in the year 2022. And since then, I am working here at AIIMS Patna.
Okay. So first of all, tell me why you have taken chosen this profession.
Okay, so to be very honest and be very frank, it is very clear that at least the people that I know, they have not chosen nursing as a profession from their own will.
Okay.
So I am also one of them.
Okay.
So I chose medical in 11th and 12th because I wanted to work in a healthcare sector, but as a doctor.
Okay.
But then in 2015, when I gave the entrance of Bachelor's of Honors of Nursing, which is conducted by AIIMS Delhi.
Okay.
So again, I'm grateful to God that He helped me and I qualified that exam.
Okay.
And since then, I never looked back and I have not regretted choosing this profession.
Okay. So your wish is to make something on the medical field, right?
Yes, sir.
Okay, to get something on the medical field.
Yes, sir. Because
Right.
I read somewhere then when doing good in a world is a part of your job.
Okay.
So that is what nursing is, or whosoever is working in healthcare sector.
Okay.
So doing good is a part of our job, and that is it.
Okay, that's fine.
Yes, sir.
All right. So, how did your MSc in nursing? What are the strategies that you have implemented to get with the
Okay, so-
entrance of MSc in nursing?
So the day I chose this profession, nursing profession, I thought that bachelor's of nursing is the full stop. After that, there is nothing further. But as soon as I was going through and growing through this profession, I realized that there is much more that people know.
So, when you exactly realized, on which year?
Sir, in third year itself, because
Third year.
that was the year when AIIMS introduced Masters of Nursing. AIIMS Delhi was already having this course, but other new AIIMS, like
Okay.
apart from AIIMS Delhi, whosoever.
So, which
the
year it is?
2018.
2018. So, the other aims have implemented. So, they have taken. They are with this MSc nursing, studies and all.
Yes, sir.
Started
At
on
17 to 18, it was
17,
the
18,
17,
that year,
18
right?
was the first batch.
Okay.
So for other aims. So when
Okay.
I saw my own seniors excelled in that exam.
So from where you find it out, the other aims also is now provided?
So from my seniors itself,
Oh, your
because
seniors.
yes, sir, because that was the year that other aims that they introduced this MSc nursing course.
Okay.
So when I chose AIIMS Rishikesh in my bachelor's, in third year itself, I realized that there are other AIIMS also. Earlier, I was only knowing about AIIMS Delhi, but during my counseling process, I got to know that there are other AIIMS also.
Okay.
So what?
So many people I think don't know
Yes,
there
sir.
are other aims. Now only I think everybody knows there are so many.
Yes, sir. So
institutions
they get
in this
surprised if we say that we work in AIIMS Patna or we have studied from AIIMS Rishikesh. They are surprised because they only know about AIIMS
aims
Delhi.
Okay.
So what happened is in 2007.
Still, I think 25% of the population I don't
Yes,
think
sir.
they
They are
know,
not aware.
They
are not aware. Yes,
Okay.
sir.
Right.
So in 2017-18, when AIIMS introduced this, so our seniors were studying for the entrance exam.
Okay.
Because what the information that I would like to give is AIIMS is the only institute amongst all the institutes who never asks for an experience after your bachelor's degree to sit in an entrance exam for your postgraduate degree.
So what about this PGH Chandigarh? And
They ask for the other institutes that you are asking, excluding AIIMS, they ask for 1 year of working experience, be it clinical.
even in JIPMER?
Yes, sir. Be it clinical or be it this teaching from a teaching sector.
Okay.
They ask for
So
a
1 year experience is mandatory for other institutions.
Yes, sir.
But for only AIIMS,
Yes, sir.
okay, they don't need any experience.
No, sir.
After completion of BSc, you could directly go to MSc.
Entrance exam.
Oh, That's
Yes,
a
sir.
good part,
That is a
actually.
good part, and that is why so many students directly after bachelor's they are pursuing their master's degree nowadays.
degree, yeah.
So that is the time when we got to know that okay, there is MSc nursing also, and then there is PhD also, and then there is postdoctorate also.
Okay.
So it is well said that you grow through when you are going through something. So that is what has happened to me.
Okay.
So I've grown through what I was going through. So in third year, I realized that there is a course, MSc
So many of the
nursing.
aspirants will found this as a new information from our video, like those who need to go for MSc and all. There are so many aims now. Almost all the aims are
Yes, sir.
providing now, right?
The immediate aims who have just opened up, they have not started with the MSc nursing courses yet, but the other aims like
Okay, those aims on the budding phase, they are not started.
Yes, sir.
But already established all aims.
Yes,
I
sir.
think it is on 18 on
Yes,
number,
sir,
right?
18.
Something 18 number.
18 to 22 number
18 to
is there
22.
approximate.
And they are providing with the MSc nursing. So who are inspired with this video need to go for MSc nursing.
So sorry to interrupt you. I'd like to mention the name of the AIIMS who are giving this opportunity to the bachelors. So it is AIIMS Delhi, which is well aware. People are well aware with that AIIMS. AIIMS Rishikesh, AIIMS Jodhpur, AIIMS Raipur, AIIMS Patna, AIIMS Bhubaneswar, AIIMS Bhopal.
Okay.
So 7, and now I think 2 or 3 more AIIMS. The names I'm not sure about, but there are 2 or 3 more AIIMS apart from these 7 AIIMS who are giving opportunities to the.
I think AIMS Nagpur also, right?
Yes, they have. They started or not because there was this talk of the town that they are starting with, but I'm not very sure. So
I think you haven't mentioned AIMS Raipur.
I've mentioned. Sir.
You have mentioned. Okay,
Yes, sir.
I missed it. Okay.
AIIMS Raipur is there. Yes.
Yeah. Bhubaneswar also, right?
Yes, sir. Bhopal, Bhubaneswar, Jodhpur.
7 aims.
Yes, sir.
Totally. Okay. Okay. So, what is your strategy on preparing with the MSc and all? So, whether you have got help with any institutions, those who are providing with coaching of the MSc nursing entrance, or whether you have a self-studied, or is it okay to self-study and we could secure a rank for MSc nursing entrance? Is it like that?
Yes, sir. Actually, self-study would help a lot because till date, from my graduation or be it my 11, 12 till date, I have not gone for any coaching or any tuitions till date. So I prefer self-studies.
Okay.
So it differs from individual to individual how they would like to prepare for any entrance, be it any entrance. So about the strategies, I would like to mention that as I have told you that I have completed my graduation and post-graduation from AIIMS Rishikesh.
Okay.
So what happened is in 2017-18 that time, in 2018 mainly, AIIMS Rishikesh started with only MCQs type of exam pattern for everyone, for graduates, postgraduates, for everyone, be it
so only MCQ.
Only MCQ pattern, be it be it nursing students or be it MBBS or MD students, for everybody. The exam pattern was MCQ type.
MCQ.
Because our then director sir, he used to tell that in future they will be only getting to do the MCQ type of questions for the entrance. So theory, he said, it is of use, but to see a future in India, MCQ would be a lot of help. Okay. So
MCQs, okay. So what is the advantage of MCQ over, do you know any?
200.
No. What is the advantage of MCQ over descriptive one?
Okay, so I would. MCQs have helped us a lot in a way that since the year MCQ started in AIIMS Rishikesh, students have only progressed, and that too as compared to other institutes, the weightage of our students qualifying the entrances used to be very much more as compared to other institutes.
Okay, so it will help them in all the entrance exams because all the entrance exam models are MCQ
type. And also,
so practically that is a much useful thing, right?
Yes, sir.
Comparability to the students and upcoming aspirants, right?
True.
Okay.
So what happens is when we are giving a theory exam, we only prefer either 1, 2, maximum 3 to 4 books for theory exam. But what happens with MCQ type of exam pattern, you will refer all the books that are available as much to your knowledge, or you'll ask your seniors what book is there for this particular subject. So
is there any particular books which contains MCQs for preparation, like question?
No, sir, that is the best part of AIIMS Delhi. When they conduct the exam, the weightage of all the subjects is very equally divided. Be it nursing research.
No, I'm asking the subjects, they are equally divided. But is there any, whether students could rely on any rank fail type things?
No, so there's not a particular book for MCQ.
MCQs. Yeah.
So it differs from subject to subject.
Okay.
So first
The
you have
only
to
thing
finish
necessary is, and it will work is you need to go through with all the topics.
all the topics.
And you need to prepare, like, you need to get question like MCQs.
Yes, sir.
So you need to have an in-depth knowledge regarding
That is
all the
true.
topics.
Yes, sir.
right?
Because from one line itself, there will be multiple MCQs. From one, that is what we have experienced during our.
They will only change the options. I
Yes,
think,
sir.
Right.
And this has helped because once we finish our, I'll give you example. For example, a student from a different institute, and I'll keep myself as an example and the other ex participant. So I'm from AIIMS Rishikesh, for example. In third year, we were introduced with MCQs. Now I know all the books.
Okay.
That okay, this book I can touch, this book I can touch. I'll go through at least once with all the books.
Okay.
But there is another person who is from a different institute who has gone through a theory type of exam pattern.
Okay.
So he or she might not know what all books are there to prepare for the entrance exam. So they will touch those books later after completing their bachelor's. But I've already touched those books and gone through that books during my study period itself, like when I was in my undergraduation period. So I am in a way more like experienced of the books and more knowledgeable about the books, that what all things are I've already gone through. Now I'll revise, but the other person will have to
So it
start.
will be very easy for you to crack on any entrance exam now.
Yes,
like,
sir.
Related to nursing.
Yes,
right?
sir. So that is what has helped AIIMS Rishikesh students to.
But the recent, the recent question type I have seen, like, it will include, arithmetic reasoning and all these things.
Yes, sir.
also. So what to do on that actually?
So that is where we fail, to be honest, because we
Because
leave.
most of the nursing students, I think, like, they have chosen nursing. It is, I'm not generalizing, but because they are a little bit, they are difficult in the part of
Maths.
maths.
Yeah,
mathematics.
true, sir.
Yeah.
So that is where we are lacking. That is where we are failing. Because when we sit in an entrance, and these days the type of.
There, I think we need professional help of
Yes, sir.
some agencies
Yes, sir.
or
Yes, sir.
institutions, like, right, to
Yes, sir.
give
So
accurate coaching related to that.
that is where we are lacking, and
Because
that is
now
why.
they have implemented current affairs,
Yes, sir.
reasoning, and all these things also on the newer type
Yes,
exams.
sir.
And I have heard, like, in MSc nursing also, entrance tests, they are actually going to implement this.
Okay,
like
sir.
that.
Okay, sir.
So the upcoming students, for them, it would be a little bit
Yes, sir.
difficult.
They have to
for
buckle up
cracking the-
themselves. Yes,
yeah.
sir.
So they need to actually start the subject which they are lacking and which is much difficult for them.
Yes, sir.
Okay.
And one more advice that I would like to give the MSc aspirants, those who are looking for, that decide your subject in third year or in fourth year itself before sitting for an entrance. Just don't do MSc for the sake of doing it and getting an additional qualification.
Okay.
Because I would like to, like, in a funny way, I like to quote that, the subject you are going to choose is going to be your love marriage. So it will be with you till the day you die.
Okay.
But if you're just doing it for the sake of doing it, it will be an arranged marriage. You won't be happy for a longer period of time. Like, you have to adjust with that subject, and it will take time.
Yeah.
And while you are studying, like, for example, you have already
So that
decided.
means, I think, for making it simple, I think, like, if I am interested in med surg nursing,
Yes, sir.
then I couldn't able to. So it is not preferably I need to choose community nursing.
Yes, sir.
Like that.
And in
Right.
medical, surgical also, we have different
And if
subjects.
if somebody is not sure, like, what they need to choose, they just need to do MSc. Then it is okay to choose anything that.
Yes, so that is what I'm saying, that if you just want they only need an additional qualification or a sum up in their degrees, then just do. But if you have this mindset that I only want to do it in this subject, but because you are confused that in the later year you might not crack the entrance exam, and this year you have qualified, so just choose the subject and just finish it off, and just and then later you decide what you want to do. But don't do that with yourself, because what happened in those 2 years of that post-graduation period, you won't be satisfied.
Okay.
You have to completely engrossed with the subject that you have chosen.
And what about if you are choosing on after post study of because you are already postgraduate?
Yes, sir.
So if you want to take a PhD, and your subject, I think, psychiatry you have chosen. So if you want to take PhD,
Yes, sir.
whether you need to take PhD on the same subject, or you could.
No, sir. That is one, I would like to say, advantage also. Like, because in PhD we don't have to choose the subject. We have to choose the research topic.
Okay.
So research topic could be from any field.
Any field. It is not mandatory like you have taken the post-graduation on psychiatry.
No, sir.
So you need to take a PhD on the topics which is related to psychiatry. There is no mandate
not
like that.
not a compulsion.
Not a compulsion.
It is completely out of your own interest.
Okay.
Like if I am from psychiatry and I want to study on diabetes.
So if somebody who have got a subject which is not their preferable subject, like if I want to get psychiatry and I have got community, but later on I am thinking like now this year, because the time is very short actually, and there is no surety. Like if on this year I will crack the entrance and the same next year I could able to crack the entrance. Okay, but I haven't got the specialty this year and I am waiting for the next year. Better than that, I think you need to go for that, whatever you have got. And when it comes on your PhD, you could take the subject of your interest like that.
So that is what I'm telling, that in PhD there is no subject or theoretical thing that you have to go through books or something. PhD is all about research and only research.
No, like if I want to do a research on the topic of psychiatry, because psychiatry is my interested topic like that, or subject like that. But I have undergone post-graduation on community or something like that. Then I could do that. There is an option like that.
I'll give you an
I
example.
don't need to miss my 1 year of entrance, that rank and all these things. And I need to wait for the preferable subject like that.
So I'll give you an example. For example, you want to pursue a PhD in now psychiatry. You have already done in community. You have done your masters. So in psychiatry, if you are going for PhD, you have to choose a topic which includes kind of both. For example, in community also mental health is of great concern. So you can choose a topic which is a mix of both. By doing that, you can share your knowledge of community in your PhD also, and you are into psychiatry.
Like that.
Yes, sir. So that entrance thing, I'll actually in 2019 itself, in 2019 also I cracked the entrance of MSc nursing, but at that time I was not getting the choice of institute and the choice of seat. I always wanted to do my masters in psychiatry, but in 2019 I was getting gynae and community from different institute. So in 2019 I dropped my seat during the counseling round. So in
because you haven't got the preferable subject.
Because it was there in my mind. So many people told me that because there was COVID, so many people are telling me that you have left that seat now, you might not get it. What is the chances of you getting your choice of subject and then your choice of institute? But with the right books.
But still it is a little bit risky decision, right?
Yes, it is a risky decision, but I never wanted to compromise with the choice of subject. In the beginning of the video itself, I told you that.
But I think for the aspirants, it is generally not advisable to do like that. Right?
No, sir. It differs from individual to individual. Like if you have a choice of subject, go with that subject. Have faith in yourself that next year you will get it, no matter what. Or in the first hand you can get it, because AIIMS is having a number of seats now in different subjects, different specialities. So
if you try well, then definitely you will get your preferred subject like that.
Yes, sir.
And how about your MSc nursing student life like that?
So it was hectic because yes, sir, it was hectic because in nursing first year we have 4 subjects: nursing education, advanced nursing practice, your specialty subject, and nursing education, advanced nursing practice, and this specialty subject.
So whether you have a clinical postings also like that?
Yes, sir. From first year itself, because as a MSc nursing, you're not a fresher. You have already done your bachelor's. You have already finished the basic course that was required. So they don't treat you as new students or something. You are already experienced students. You have already seen clinical settings and all.
So what are the things that you will do in your clinical side when you have posting on the MSc time?
It is one good thing about MSc is the choice of subject you have taken, you will be only posted there. So that is why I was telling that only choose.
Whether you have assignments over there, like
a lot. So that is what I was going to tell, that in first year and second year you have research. First thing, what make you a different individual once you finish your post graduation is research. Research and innovations. That is what make you a different individual and make you look like that you have done something different from other students. So first thing is research. So from first year of post graduation itself, research is the big thing Like
Okay.
you have to choose the topic, and
So
then
whether you will get enough time to complete your research, and you have clinical postings, you have classes.
yes, so that is why I told
Management.
that it is a bit hectic,
Hectic.
but time management is one thing. If you have learned it,
Okay.
it will take time, maybe 6 months or 7 months.
Okay.
But once you have
To
learned
adjust with
it,
this
yes, sir.
process, right?
But once you have learned it, it is all good. Because in a day we used to have 3 to 4 seminars. Because as I said, 4 subjects in first year.
Okay.
So specialty presentation would be there, and then advanced nursing practice presentation would be there. Nursing
So
education.
on your specialty like psychiatry, what are the things that you need to present like on the clinical side? Whether it needs to be like counseling to the patient's attendant, or to the patient you are giving some health education like that.
Okay. So first of all, theoretically, I'll talk that if I have chosen this subject, if I'm doing nursing in masters in psychiatry, so the subject itself, the syllabus itself, will be divided among the students. For example, we were 3 in number in our specialty, so
Okay.
the syllabus was divided among 3 of us.
Okay.
So that particular portion which is given to us, we have to present a topic or present a seminar over it
Okay.
amongst us or to the juniors.
Okay.
And clinical is a completely different thing. Clinical will be posted with our juniors, for example, third year BSc students or MSc first year students, or with our seniors for say. So there we'll be the one, and obviously we'll be with the tutors or the faculty members and the nursing staff also. So there we have to teach our students also, like the juniors also. So we have to treat them as a student.
Okay.
Once you are masters,
BSc students.
yes, sir. You have to treat them as a students and not to mention that they are our juniors. Treat them as a students and have that gap. That is what professionally we are taught.
Okay.
So we are supposed to teach them whatever topic. Like for example, the basic topic in psychiatry is mental health examination. So we are supposed to teach them that.
Okay.
And then we'll be supervised by our seniors, for example, our tutors or our faculties. And there we are supposed to give, like our culture was different. We used to have morning assembly with the patients. So that was our routine during our student period. So we used to have a morning assembly with the psychiatric patients. And on every Saturday or every Friday, if Saturday is a holiday, then on every Friday or Saturday, any day, the patient's attendant would be having an assembly where we'll be giving counseling to them.
Okay.
Or we'll be taking their feedbacks, how they are feeling. Because what happens is, more than the patients, the attendants suffer, especially in psychiatry ward.
Okay.
So we give exclusively Saturdays
I
or
think the
Fridays
more than the patients, the attendants will suffer, right?
in psychiatries.
Okay.
Because patients are not
Aware.
yes sir what is happening or what. So our motto during our student period was to involve the patient in the activities so that they are not completely engrossed in their disease.
Okay.
For example, if a schizophrenic patient, he'll continuously self-talking is there. So we'll give an activity to him like drawing or writing or whatever he's interested in. So he'll be completely involved with that. We'll give homeworks to the patients. So our shift
And we will
would
teach
be,
the same to give to the attendant as
yes
well.
sir.
Right?
So this is what our part was as a student in
And
psychiatry.
some of these psychiatric conditions are extremely curable with the medications and all. But because of the reluctance of the patient attendant, it could happen like they don't give even medications. They won't, and they will do some other alternative,
Yes, sir.
which is not at all working
Yes, sir.
like that. So, what is your opinion about it? Have you faced with such things like when
Yes,
you
sir.
are?
But but the problems which attendants told us was completely different. Like they told us that financial issue was there,
Okay.
and then they were living in hilly areas, so it was not convenient for them to
To travel.
come. Yes, sir, to travel. These were their problems. Their problem. They were not
But
reluctant.
they are not reluctant on the
No, no,
treatment
no.
part.
The
They are
thing was they were
reluctant
not
to give.
regular with the follow-ups because of the travel issue.
That's the only problem. Like, okay, so in
Most
my
of the, like-
experience, some parts they don't want to take medications.
Yes, sir.
They will have the traditional treatment of doing something
Yes,
which
sir.
is
Yes, sir.
extremely
Yes, sir.
not useful, and it's actually idiotic things.
We have seen so many relapses during our study. We've seen so many relapses. Like very young adults would come with the relapse cases.
Okay.
So, but it was because of financial issue or because of they were not regular with the follow-ups.
Okay.
Or other issues, but they don't want to. At least patients were like that. They don't want to take the medicines because they are not in that state. But attendants, we have never seen that they don't want to give the medicines.
Okay.
They used to follow their cultural beliefs, like they would go to the healers, faith healers,
Okay.
They would go to the faith healers, but they would take medicines also.
Okay.
So we were the ones who used to tell them
That's
that
a holistic approach. Like,
yes, sir.
okay.
Yes, sir.
So one part it is belief and one part it is science. That
Yes,
would,
sir.
I think it's okay.
Yes,
But
sir.
sometimes they will skip on some parts. They will skip completely the medications and treatment. They will go to the faith healers only, and that is dangerous. I think.
Yes,
Right?
sir. Yes, sir.
That it also happens actually like
sir.
that. Okay, so that's about your student period and also on MSc nursing, like with the patients, involvement with the patients and attendants, giving health education and support, especially to the patient attendant. So after your post graduation, so you have got your start working. So how you feel like after that?
Okay, so as I told you that I've already worked in clinical setting after my BSc nursing.
Okay.
And that time was a tough time because that was the first wave of COVID. So I've worked in COVID. First I was posted in pediatrics ICU, then I was posted in neuro ICU, and then suddenly COVID happened. So
All ICU experience, right?
so COVID ICU,
Okay.
and then into MSc, and then I started working here at AIIMS Patna as a nurse. So currently I'm posted in trauma OT.
Okay.
So as I've told you that my specialty is psychiatry,
Okay.
but I'm in trauma OT.
Okay.
So when you are just passed out, you're just a fresher. Like after masters, I was a fresher.
Okay.
But I was specialized in a particular subject.
Okay.
In a specialty, I was having a specialty.
Okay.
But I was posted in trauma.
Okay.
So what happens is, like, I am well adjusted because I've worked further. But one of my friends who is working in a different institute,
Okay.
she has done her masters in CTVS, cardiothoracic and vascular.
Okay. Okay. Yeah.
So she's posted in emergency area.
No, another institution, right?
Another institution.
Okay, so she have got an specialization in CTVS,
CTVS, but
cardiothoracic. But obviously she need to be placed on CTVS IC or something like that. But she have got a different experience, like emergency.
Yes, sir.
Right.
So initially she was like, because she used to call me, because you know what happens when you are in a psychiatry, like I've done my master's in psychiatry nursing. So three of us, our own batchmates would consult us for some counseling or something. Three of us, they would call us. So that is what happened initially. She was not able to adjust to that environment. So she shared her experience with me. That is what I'm sharing here. She told that she's in from CTVS, so ideally she should be posted in CTVS area where she could implement her services and theoretical knowledge very well.
Yeah, the skills and the knowledge what she have gained from the post graduation.
Yes, sir. She could implement it very beautifully in that particular area, but because she is in some different area, so she called me and she was upset with this thing.
Okay.
That she's in a different.
So actually,
area.
we need to consider the emotional that part of the part of the professional as well, because they want to do such thing in such a speciality, and if there is vacancy on that particular speciality, and they could be able to do, I think they could better perform on such areas, right?
Yes, sir.
They are specialized on.
Yes, sir. And she was upset because she requested the administration also that she has this and so experience, and it would be great if they post.
But there is no vacancy on that area, that particular area, like CTVS?
Yes, sir. There was no vacancy, but she also gave she also gave a suggestion to them that there are bachelors who are posted in CTVS, so you can shift the bachelors to emergency.
Okay.
Only one vacancy they needed. Because she is from CTVS, only one vacancy they needed.
Yeah, CTVS ICU or CTVS, there are so many CTVS ward also there. Like there could be one vacancies that if the individual will get, and it would be fine, right?
Yes, sir.
Like that.
So
regarding on that aspect, otherwise there would be, there would be a desperate. It would be desperate for them.
So that has
some type of disappointment.
Yes, sir. Disappointed and a very lack of self-confidence.
So how you counseled that individual,
Sir, the only thing I told her that, see, you have done bachelor's, you have done some basic study in nursing.
Okay.
So you have done you have been into postings during your student period in emergency when you were doing bachelor's.
Okay.
So go to emergency area and explore. You will get to learn new things.
Okay.
CTVS you have already worked for 2 years. Just go to this new area, learn experience.
You have placed that attitude, like you will get an opportunity to
be in yes sir, yes, a new environment, because 2 years you have already been working in CTVS. Just go and explore something new in emergency. You will get to see different cases, and it will only help you grow.
Okay.
That again, growing through by going through something. That is it.
So now she is okay, right?
yes, 6 7 months it was like, so that is what I'm telling you, lack of self confidence, lack of self esteem. You are already a postgraduate, you're posted with, I'm not comparing bachelors or masters, I'm just stating facts. You have completed bachelors, you have completed post
Actually, that institution
graduation.
needs to completely use the, that the proficiency of that.
Resources
Yeah,
should be
resources should be
used
used
beautifully.
properly. Yeah.
Yes, sir.
And also, she have completed with CTVS
Yes, sir.
and
And
with the
from a
PG.
good institute.
Yeah. From
So,
AIIMS Rishikesh, right?
yes, sir. My batchmate.
Okay,
Yes,
yeah,
sir.
yeah. All
So
right.
this is what, so if she is in emergency, she'll be completely new to that area. She knows nothing, and the others will treat her as if she's a fresher. She knows nothing. So she'll feel that those 2 years of her study were a waste of time.
So any of your friends have told like, there are, so this is a different case.
Yes,
Like,
sir.
she have a specialty and the specialties is not being
Yes, sir.
adequately used
Yes, sir.
by some institution. So whether any of your friends have told you like, uh, uh, even when there is, competency for them to work in a particular area, and they are constantly get denied on that particular area just because of favoritism or something like that.
Yes, sir. There are also a number of cases, a number of experiences that I have of other people that I would
Because the
like to share.
administration will favor those people who are
Known to
known to
them.
them and something like that,
Yes, sir.
and those people who have a genuine thing, like if they have a family, children and all these things, and then they have a genuine thing to be posted on such areas, like they have got denied like that
Yes,
as well,
sir.
right?
So, my own specialty girls, like I would not like to mention her name, but she's from psychiatry. She was my specialty mate.
Okay.
So, my own batchmate. So, again, she requested the administration during the time of ward allotment that
Okay.
it would be great if they post her in psychiatric OPD or any counseling center which was there in the institute or ward, psychiatric ward. But they denied, saying that they only post those nurses or those staff in psychiatry ward or OPD or so and so who are themselves not fine. For example, the female who is pregnant, who cannot work in medicine ward or surgery ward because of,
So they have been posted to
psychiatry ward, because people have this perspective that psychiatry ward has very less work. No, mentally it is
It
very
is very
exhausting.
risky, actually, right? And it would be very hectic also, right?
It is
For
mentally
especially for pregnant,
exhausting.
yeah, pregnant ladies, how they could work in psychiatric ward, I don't think so.
They told that those who are not physically fit, they are posted in psychiatry ward. So you are very, like, you are young, you are
So how
physically
these
fit.
problems come, like, whether the administration is not that much capable to make it, like, whether they are making it no sense on that, like
Yes,
that,
sir. According
on
to
their
me, it
thing.
is, they are making no sense on that, because see, sir, what, like, I'm not mentioning anybody's name or any institute, but out of experience, I'm telling, and by listening to other people's story,
Okay.
and by seeing such incidences, that in higher positions also, we need to have, in higher position also, we need to have people who are well educated, more than just, they just should not have this bachelor's degree. In higher position, if somebody is there in higher position, they must have some higher degree, so that they can understand the value of the person who has completed a particular course, and what is their importance in a particular specialty area.
Okay.
That is the only reason I would like to mention. That is the only reason that these days most of the MSc nursing seats are going, like students are vacating the seats. They are joining the course, but as soon as they are getting into government sectors or government jobs, they're leaving the seats,
Okay.
because they see no benefit out of a post graduation degree.
Okay.
So they just join a job, because what I've seen many of my juniors saying that, like in Hindi, if you don't mind,
Yeah,
I would
the
like
main-
to quote. Verbatim is there. I'll explain, like I'll translate the verbatim is कि मास्टर्स करके भी क्या करना है, क्योंकि हमें एरिया वही मिलेगा जो उनकी मर्जी होगी, जहां सीट होगी. दैट मीन्स दैट दे आर सीइंग नो बेनिफिट इन मास्टर्स, विच इज वेरी बैड, because there is a lot of a good scope in future if you are from, if you have done a bachelor's master's degree.
Okay.
So-
but some institution have placed a notification like those who are qualified with a master's degree, they will get posting on their specialization. Some, premier institution have placed it like that. Okay. And I have heard from many of the friends, like comparable to other AIIMS, AIIMS Patna is better in the sense like, friendly working environment and
Yes,
all
sir.
these
Working
things.
environment is friendly over here because yes, I have friends in other institutes. So I actually like I don't know how many of you will believe, but I have actually told them that you can join this institute because working environment is friendly,
And
stress
comparable with
free.
this, favoritism and all these things, comparable to other AIIMS, I think it is much more
Yes,
better,
sir.
right?
I have not worked much because I'm not that
Yeah.
experienced, so I cannot say that. But yes, I am working here, so I would say that yeah, whatever, because I've worked in some other institute also, so it is friendly, like
Yeah.
work friendly.
Work friendly.
Yes, sir.
And we will get a work satisfaction and all
Yes, sir.
this.
You will be given freedom to decide for your patient
Okay.
in that sense.
All right. Yeah. Okay. So, is there any other problem that you could find out while with your experience and all? Like,
So where to start with a lot actually.
in terms of technical resignation and all these things. Now it is there. There is notification from the ministry and all
Yes,
to
sir.
different institutions. They are asking like their feedback. Different institutions need to give their feedback on technical resignation and all this.
I feel that is a very good decision.
Okay.
It is actually very important. It was actually very important.
Because when somebody is working for that much years and all added to their service, because otherwise their service is going on a wane, like there is no point in this much years of experience when they are moving to a new institute. They are
They have to
not getting
start
any
fresh.
pay protection or anything like that.
Yes, so they have to
Their
start
service
fresh.
is not counted, and it is something which is very ridiculous, to the professionals,
Yes,
like
sir.
especially on such a field like which mandates appreciation all the time.
Yes,
like,
sir.
Okay.
So, on that note, I would like to address one thing that again, because like masters from out of masters of nursing experience only, I'll tell you. Like, for example, I cannot pursue my career in teaching as of now when I really want to.
Okay.
Like I really want to be into teaching side, not because of like because people have this preconceived notion that in clinical areas you don't have respect. I don't think we are in any competition with anyone.
Yeah.
See, so I
But
don't.
what is the problem? Like, if you want to go for teaching, you have post graduation in psychiatry, so you are well qualified.
Yes, sir.
And you have given with much presentations on your student time itself, and you could teach well.
Yes,
Actually, the
sir.
students,
That is
you
what I'm
have the
telling.
skill. So what is the problem?
See,
Actually?
that is what happens, that because I did my masters because I wanted to continue my career in nursing, but in a field of teaching.
Okay.
Because I feel that I am more skilled in teaching as compared to my clinical hands.
Okay.
So actually people identified whether they are perfect in clinicals or in teaching or in some other area or in research or what. So I've identified very early in life that my skills is in teaching. So
Okay.
I'll continue with my this further education, and then I'll go into teaching. But what happens is, according to our council, that is Indian Nursing Council,
Okay.
I would like to mention, they have a very clear-cut rule that once you have completed master's degree in
Okay.
nursing, you should have 1 year of teaching experience
Okay.
to secure your career in teaching in any premier institute, central institutes.
Teaching experience.
Yes, sir. You should have a teaching.
Teaching
They have very clear-cut this rule, which is a good rule. Obviously, a fresher master should have a good experience.
Okay, somebody who have pursued masters and where they are working in AIIMS like institution on the clinical side, so they obviously won't get the teaching experience.
No, sir. So
Then how it is possible?
yes, so
for
that
them?
is what I'm telling. That I'll clear this thing to the viewers, to the audience. So INC have this rule that they, after masters, you should have a 1 year of experience so that you can secure your career in teaching in a reputed institutes or to sit in for an entrance exam for a central institutes.
Okay.
But what has happened, that we have autonomous institutes in this country.
Okay.
So many autonomous institutes. So they have a different rule.
Okay.
So again, by taking INC's rule that for masters it is 1 year, for bachelors it is 3 years.
Okay.
After their bachelors, you should have 3 years. You have finished your masters, you should have 1 year.
1 year.
But our autonomous institutes have their rule that be it bachelors or be it masters, you should have 3 years of experience from a teaching institute. So the
Okay.
question
from
that
the
you
teaching
asked,
institute, it is not teaching experience, but from the teaching institute, you have a postgraduate experience like 3 years.
yes, sir. So,
So which
the
is
question,
entirely different, like from the INC rule of 1 year.
yes, sir.
But there, the INC rule is 1 year teaching experience.
Yes, sir.
And here, from
Teaching
any
institute.
institute, but 3 year experience.
But so it is. Same for bachelor's also and for master's also, to sit for
So
an
if somebody,
entrance exam.
somebody have got bachelor's and they have 3 years experience, and after that they have taken masters, whether they are eligible for.
So then they are not supposed to mention that they have master's degree, because after bachelor's they have 3 years. After master's they don't have 3 years. So they can on the this form, when they are filling the form for so and so institute, whatever institute has an advertisement.
Okay, so from the latest experience, whatever it is, whether it is BSc or MSc, after the highly qualified experience, they need to get with 3 years.
Yes, sir.
From the latest experience.
Yes, sir.
Anything.
Yes, sir. So 3 years, like that is a teaching institute. So the question that you asked, that someone who is working in AIIMS Patna, it is a teaching institute, so whether they can appear for an exam or not. So for example, me, if I have completed
But
masters,
you need to complete 3 years.
3 years from a teaching institute. So now I am eligible for the exam, to sit for an entrance exam which has been conducted by any institute for a teaching post. So I am eligible for an exam. Now I have qualified, for example, I have qualified that entrance exam. So I am a master's with 3 years of experience from a teaching institute. On the other hand, there is a person who has completed their bachelor from a teaching institute and they have experience from a teaching institute. And then there is a PhD holder who is appearing for the same post and having a good experience from a teaching institute or from teaching itself.
Then obviously the score will go to the PhD side,
Yes,
right?
sir. So bachelor was only eligible to write the exam. But the essential.
So no institution will take that bachelor's when
So why?
they have
Because they have PhD, they would
But
not
it's
even.
all related to the merit, right? Whether they score good in, but after that there
Interview
will be
also,
interview
sir.
also.
Interview also.
So at the time of interview, they will only select the highly qualified one.
Qualified one, and
According to the rule
for
of-
example, if I am masters, 3 years of experience from a teaching institute, another master person, 3 years of experience from teaching, not teaching institute, from teaching itself.
Teaching itself.
So
So
he'll
somebody
be
who
more-
have a teaching experience itself and somebody who have a clinical experience on a teaching institution, then they will
They may prefer the one who is having teaching, which is good from their side. Like if we see from their point of view, it is good. They are choosing a tutor, so obviously they will go for someone who is having a exclusively teaching experience.
Okay.
But no, I have seen people who have worked in teaching institutes and then they have ended up being a tutor. So it is completely the call of the person in the interview panel. What they are looking for in a person, for their employee, what they are looking for, whether the person is qualifying their criteria or not, it is completely up to them.
Okay.
So, and these days, again, I would like to share the new information.
So somebody, for an example, if somebody have qualified as a bachelor and have got teaching experience in as a tutor, then quit the job and go for MSc, post graduation, and they have completed with the MSc. And when they are applying for again for this teaching faculty, then whether they will be qualified on that. How is the chance?
Sir, they are already eligible.
According to the competitors, like
they are already eligible to write an exam. For example, the person, whatever example that you give, he is eligible to write an exam. Now he is there for the interview. Now they will see that okay, this person is having master's degree also, but before master's he is having 3 years of teaching experience. But after master's he has no experience.
Okay.
So it is completely their call whether to take that person or not to take that person
at the time of interview.
Yes, but while writing, like while filling the form.
So there is no fixed rule for that actually.
But while filling the form, the person can only mention about his bachelor's degree because he is having experience after bachelor's. He cannot mention master's because, for example, if my case, I have finished my master's in 2022. For example, I had experience.
So if you are placing masters, then the chances will get decreased.
Because you don't have experience post-masters. So
they will take it badly like that. Even if you are qualified with the teaching experience before masters.
But they have clearly mentioned that for BSc Nursing Honours, 3 years of experience, Masters of Nursing, 3 years of experience, and desirable is Masters wala. The one they'll only go for. Obviously, if there is a Masters and there is Bachelors, they'll prefer Masters. If there is a PhD, there is a Master, they'll prefer PhD. Who's having a good hold in degrees.
No, my question is like somebody who have a BSc experience and post BSc, they have a teaching experience also. And somebody who have a BSc and 3 years experience in teaching institute on clinical experience. Another person, BSc and also 3-year teaching experience and also have master's degree. So which one they will select on your experience?
If I am in the panel, I'll go with the one who is having teaching experience and master's degree.
Okay, the third one, right?
Yes, sir.
Okay.
The third one.
But usually it is not like that.
Yes, sir.
You are
It is
telling. Like
completely.
somebody will, because we need to hide the masters if you are going for such attempts. Like
Yes, sir. Because at interview, during the time of interview, you can tell that you are masters also, but you were not having experience post master, so you could not mention. That is not at all a crime, because you have fulfilled the criteria to sit for an exam.
Okay, you have already. I am my according to I
Yes,
am
sir.
eligible, right?
Yes, sir. But during the time of interview, you can share the information that you are having an additional qualification, but because you were lacking the experience, you could not mention this degree over there. But he was eligible to sit for an exam, so there's
Okay,
no
fine.
crime.
That's all fine. So, any notes for the upcoming MSc nursing aspirants from your side?
Yes, sir. Decide in third year itself out of the specialty subject which clinical area you are interested in, which subject you are interested in, and if you have decided, then go for it. Like, it is not that there is no benefit of doing a postgraduate degree, because there are advertisement these days where
So you can tell the
desirable.
scopes of.
Yes, sir.
Yeah.
So there is desirable is always these days a higher degree. Desirable qualification is always a higher degree. So scopes, there are many scopes. Once you have completed a higher education, specifically masters in nursing, you could be a nurse researcher. You could be healthcare project manager. You could be a nurse educator.
Whether somebody could join WHO.
Yes, sir, they could, especially the people who have finished their or completed their post graduation from community health nursing.
Okay.
Like, they hire
Community health
yes, sir,
nursing.
they hire the community health nurses. I've seen 2-3 of my seniors from different
Those who want to
institutes.
roam around the world with a panel of WHO, they need to choose community health nursing.
Yes, sir. Also, if you are a psychiatric nurse, there are a lot of scopes in abroad. In India, also post pandemic, people have a great concern towards mental health.
And we are considering USA and Canada and
Yes, sir.
Australia, specialties of psychiatry. They are the most highly paid nurse
Yes, sir.
on my belief, and also whatever my friends have told me and my experience as well.
Yes, sir. So, because post pandemic, everybody of you might have seen that mental health is of great concern for everyone, because everybody was locked inside their rooms. No, for some people, there was nobody to talk to. So, it has helped a lot. People are now very much concerned about mental health. So, nurse manager, nurse researcher, healthcare project manager.
And there is one quote from WHO, like most of the non-communicable disease, which is the higher chance of non-communicable disease that you will get when you are stressed too much because of the cortisol level in the
Yes,
body.
sir.
Just like that.
Yes,
Even
sir.
cancer and all this.
Yes, sir. So just don't see that after bachelor's there is a full stop. No, put a comma, explore, and then come back, and then put a full stop once you are done. Like, just don't believe what you hear. See through your eyes and then believe. So that is what I would like to tell them, and prepare well. It is in your hands. There are approximate 200 seats, in, including all the just AIIMS I'm talking about, and they are offering different specialities. And in MedSurg also we have sub parts. In MedSurg we have CTVS, neuro, nephro, uro, oncology, cardiothoracic. Like, there are multiple specialities. So just go critical care, exclusively to critical care. So just go for it and explore it. It is good to have a higher degree qualification with you. And also one more point, just I'll state it as a reward, that if you're pursuing your degree from AIIMS, you're getting 15,000 stipend during your postgraduate time period.
Okay.
Except for AIIMS Delhi. It has not started yet. But there is one more thing, that when you're leaving the seat, you have to pay for that seat.
Okay.
So for other AIIMS, it is like 1 lakh, but for AIIMS Delhi, it is 5,000. At any point of time you're leaving the seat, you have to only pay 5,000. But for other institute, because they are paying stipend
So for
also.
Delhi AIIMS, it is 5,000, but for all other AIIMS, it would be 1 lakh.
1 lakh or 50,000. It is different in all other
That's a
AIIMS.
penalty.
Yes, so that
if
is
you
a
are
penalty.
leaving MSc.
Yes, sir.
Right. But you
And
will
it
get
is
this stipend like it is 15,000.
It is 15,000.
So make sure, like when you are joining MSc, make sure like you are determined to do
Yes,
like
sir.
all your specialty.
Yes, sir. And if you want to leave, leave it before the open round of counseling so that the other students can get the because there are so many students who are dying to
And so many,
get it.
yeah, so many seats are vacant every
Yes,
year
sir.
as well, I
Yes,
think,
sir.
on my opinion.
Because of this NOSET that we are
Yeah.
having. So NOSET is also a very good opportunity, and it has given employment to n number of people.
We will come with another video of NORCET very soon.
Yes, sir.
And thanks for watching this video. Thanks for coming.
Thank you, sir.
Okay.